Okay, this should be a shorter, hopefully quite a bit shorter, broadcast here. So we're looking at the rest of the axial skeleton. So we've removed the appendicular skeleton. So we can see that the axial skeleton is just the skull, the vertebrae, the ribs, not the clavicle, because that forms part of the pectoral girdle. I'm going to remove, to begin with, the linea alba and even this anterior longitudinal ligament, because we're focusing on bones, not ligaments, so might as well remove a few other ligaments as well. If I can click on all of them, here's a spinous or supraspinous ligament, it's over the spines. It's worth just clicking around and getting a sense of how they name things. The intertransverse ligaments. Well, intertransverse ligaments. There's a transverse process of each vertebrae, and there's ligaments that go between those transverse processes. So that's cool. But yeah, we're not going to learn these different ligaments today. And even there's up in the neck here, intertransverse cervical ligaments, and again just going between the transverse processes. Okay, now we're all bone except for one last one, and that's that nuchal ligament that I mentioned in the last video, which, yeah, between the spinous process of C7 and the spine of the occipital bone. So let's just hide that as well. And in fact, if we can, I'm going to hide the whole skull. Bam. And hide our thyroid cartilage. And this is, never mind. We've got enough missing here. We don't need to get every little piece that's not relevant to a cricothyroid membrane ligament. Nah, we're not talking about it. We'll talk about some of those things when we get to respiratory system. But okay, now it's pretty clean. Now I think it's pretty clean. Just the rest of the axial skeleton that does not include the skull. So what do we have? We have vertebrae and ribs and sternum, right? So the vertebrae, all mammals, basically all mammals, there are a couple exceptions, have 7 cervical vertebrae. From that point, it's more variable. We have 12 thoracic vertebrae and 5 lumbar and 5 sacral vertebrae that are fused into one sacrum, which means what it sounds like, a sacred bone. I don't know why that part of you is considered sacred, but there you have it. And then coccyx, which is usually 4, sometimes 5 bones fused together. That's our tailbone, or rather the vestige of a tailbone. And there's sometimes variation. I've met people that have 6 lumbar vertebrae, for instance, and they never know that until they happen to have a back x-ray, and then they're told, oh, look, you have 6 lumbar vertebrae. So how do we tell the difference? Well, these lumbar vertebrae are rather thick, their bodies are, and the sacrum's easy, that's all fused together. Coccyx is easy. Note the intervertebral discs, and there is it's a fibrocartilaginous disc, and in the middle of the disc is a liquidy jelly region called the nucleus pulposus. And if you go squish, lifting the piano or something, then you can squish nucleus pulposus out of this fibrocartilaginous ring and have a slipped disc, right? And put some pressure on the spinal cord, which is not shown, but is running through this whole place. There's our posterior longitudinal ligament. Remember, there was an anterior one that I removed. Now there's a posterior one too. Okay, so a couple things about how things are arranged here. First, see there's a space between vertebrae, and it's an opening, so we call it a foramina. So intervertebral, between the vertebrae, intervertebral foramina. So if I was to hide one of these, see that's not a foramina that exists. It's not a foramen that exists within a bone. It just exists because there's space between the bones, how the bones stack onto each other. And you can see that the bones interlock, the vertebrae interlock, and so there are some articular processes. So the superior articular process of one vertebrae will interlock with the inferior articular process of the one above it. So superior, inferior, and that continues. And now the shape of those processes is a little different in the different regions. See here, the superior articular process, it's the facet of it, the part that that articulates, points directly back, points posteriorly. The inferior articular process of the one above it points anteriorly, and there like that. And it is articular. There is some movement there, but you can see there's less movement in the thoracic region than say in the lumbar region. So let's go down to the lumbar region again, and the processes just fit together a little differently. See that the facet, the articulating surface of the superior articular process, it points more medial, and the facet of the inferior articular process points more lateral. So just a little different arrangement in the lumbar region, and we have greater flexibility, right? We don't have a lot of flexibility in the thoracic, but with the lumbar region we can, you know, collectively have quite a bit of motion, and some people do stretching and whatnot and get really flexible there. The most flexible region is, of course, the neck. Let me hide some membranes there. Axial ligaments and stuff. The neck or cervical region has the most mobility, and when you have mobility, you lose some stability, right? There's a trade-off there between stability and mobility. Those are little ligaments that attach to the larynx. So I'm hiding those. It's interesting that they are there, but I'm hiding them. Okay, so here are our cervical vertebrae, and how do we distinguish cervical vertebrae from other vertebrae? Let's just start at the top. Well, we know the first two are very special, the atlas and the axis. So the atlas has no body. I ain't got no body. Nobody loves me. Instead of a body, how can I get the right view here? Zoom out. Instead of a body, it has, there's several ligaments here, and I kind of want to keep one of them to show you, but and that's this one, the anterior, and I don't need to keep these ligaments, but let me just point out kind of what they do. Well, here we have ligaments that help form a joint capsule with the occipital bone, right? So this is an atlanto-occipital capsule. So keeps that joint together, and since it's a joint that has synovial fluid in it, keeps the synovial fluid in there. We're hiding all that. The anterior atlanto-occipital, atlanto referring to the atlas, occipital referring to the occipital bone, hiding that too. Okay, so we're trying to focus just on this, on the atlas, and this part of it as well. Whoops, This is atlas, this is axis, right? So let me hide another ligament, the apical ligament there. There's the axis fitting into the atlas where the atlas body would be. The atlas has no body, vertebral body. Let me hide that one, and I'll keep this one. Finally got it. The transverse ligament is helping hold the dens or odontoid process. It's called both things of the axis. Helps hold that in place as we do this motion. So we go back and forth. We say no, 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 no by rotating our head and the atlas around the odontoid process of the axis. And this ligament helps hold it in place. Why do you want to hold it in place? Because you don't want to smush it or break it into this part, which, you know, that part is looking down. That's where your spinal cord goes, right? The spinal, there's a vertebral canal that's formed by all these vertebrae. We can take a look down at kind of almost, if I can control the, anyhow, you can see where the spine goes, where the spinal cord goes. And as a little gee whiz, you know, something for your gee whiz file, when they hang somebody, the idea, the hangman's knot idea is to break the neck in such a way that the odontoid process gets broken into the spinal cord. What does that do? That instantly turns you to a respirator dependent quadriplegic. Doesn't instantly kill you, but instantly you are completely paralyzed and you can't breathe. So I think that they, you know, put a bag over the prisoner that's getting hanged, because there's, you know, if he doesn't go unconscious, he's got a minute where he can look around and can't talk, but because vocal cords are paralyzed and the breathing muscles are paralyzed, but he's not dead yet either. So anyhow, that lovely thought. So the odontoid, like odonto, tooth, like, anyway, or dens, which dentist also referring to tooth. It looks like a tooth. So I'm going to remove those ligaments. Okay, so that's atlas or C1. This is axis or C2. All cervical vertebrae in the transverse process have a hole. See that? Nice transverse foramen. And the transverse foramina of all these forms kind of a tube. And it's just in the cervical region, not the thoracic. Let me maybe hide a rib there for a moment. There. We can see the start of it. So this is a transverse foramen. There are going to be some blood vessels going up to the brain. Okay, going all the way up and sneaking in right at the base of the brain there. So that's the function of the transverse process. So if you see a vertebrae that has a hole in the transverse process, you can say, oh, that's a cervical vertebrae, because only cervical vertebrae have that. Okay, so we talked about C1, C2, C3, 4, 5, 6, 7. Only in the cervical region do we see the spinous process split. So it's a bifid or bifurcated spinous process, and it's mostly C3, 4, 5, and 6. And then C7, that attachment of the nuchal ligament, you can feel that at the base of your neck, and it's very prominent in a horse, the withers of a horse, I think. Okay, and as I mentioned, 7 cervical vertebrae is a mammalian trait. So a giraffe has 7 stretched out cervical vertebrae. A mouse has 7 teeny tiny cervical vertebrae. Like I said, there are a couple of exceptions. But okay, moving along to the thoracic region. Well, the thoracic region, there are 12, and each one's attached to a rib. So if we remove a rib, you can see a little facet where the rib would have attached. So it attaches here, which this is a pretty subtle pretty subtle landmark, and it's not really showing up on here too well, but that is an articular facet for a rib. So, but by removing that, we can see a little better again the intervertebral foramina. And why is that there? Well, we talked about that there's this vertebral canal where the spinal cord is going down, and between each vertebrae are spinal nerves going out. So there are transverse nerves going out, or sorry, intervertebral nerves, not transverse. They go out sideways transversely, but intervertebral nerves going out between each vertebrae all the way down. And even in the sacrum, where everything's fused, we still have spaces for nerves to go out. Okay, so how else would we recognize a thoracic vertebrae? I don't know. They have a downward sloping spinous process, and I mentioned the anterior facing inferior articular process and the posterior facing superior articular process. So there are a lot of these are irregular bones, and they have lots of processes on them, right? So let me just hide a couple just so we can see another one isolated better, and I'll hide some other features. Maybe even hide a couple ribs so we can take a better look. Oh, look at that. We can see the nucleus pulposus of the intervertebral disc. So that's kind of cool. You can see these rings of fibrocartilage, and then there's the jelly donut part right in the middle. So that's the intervertebral disc between T6 and 7, for example. Now the vertebrae itself, again, the body is the main part, and there's an intervertebral disc on top and bottom of the body, except for C1, which has no body. I think the only other landmark that I haven't mentioned is for the vertebral canal itself, but the top of the vertebral canal, this portion here and this portion here, the branch that leads up towards the spinous process, that's called the lamina. So just that section is the lamina, and just that section on the other side. So sometimes they have to kind of open up the spinal column to, you know, work on a pinched nerve or something. So they may do a laminectomy, where they cut the lamina and can essentially pull off the spinous process. Now you can feel your spinous processes running down your back. You cannot feel the transverse processes. They are attachment sites for muscles, and well, maybe if you feel hard enough you could find some transverse processes, but muscles are attached to them. And speaking of muscles being attached, if you ever, you know, if somebody goes deer hunting, they talk about the back strap. Well, those are muscles that are attached directly to the spinous process, and these transverse processes, they're muscles that, you know, they're your back muscles. And we'll mention them again when we talk about muscles, but those are some choice cuts of meat. And in cows, we will cut like that, and you end up with a kind of piece of T-shaped bone, which is the two transverse processes and the spinous process, and we get a T-bone steak out of that. Okay. Lumbar vertebrae bear the most weight, have the widest, most robust body. I don't know what else to say about them. Blunt transverse process, blunt spinous process, blunt and wide, and the superior and inferior articular processes it's a medial lateral attachment there. And this is where we're most likely to, you know, squish our intervertebral discs. The ribs end at T12, So this is L1, and you can't look and say, oh, that looks like a thoracic, that looks like a lumbar. You know, at that point, they look pretty similar. So as one gets closer to the other, they look more and more alike. But this is T12, this is L1. Here's L1, L2, L3. So you can count up or down and know that the if you have to do a lumbar puncture, meaning you're going to go withdraw some cerebral spinal fluid, you don't want to hurt the spinal cord at all, and it's useful to know that the spinal cord itself ends between L2 and L3, or rather you can go in between L2 L3. You can do a lumbar puncture here into this canal, and you're not going to hit the spinal cord. There are still nerves running down off the spinal cord and exiting out all the way down, running down that canal and exiting out. But basically the spinal cord stopped growing before the rest of the vertebral column. So at least in an adult, you can put in an epidural, or you can do a lumbar puncture between L2, L3. Epidural is not the same place as a lumbar puncture because epi is over or around. You're trying to get into the space just outside the dura mater, just outside the meninges, around the spinal. Like the whole vertebral canal has meninges, has a covering down it. You don't want to puncture, you don't want to do a lumbar puncture and inject the anesthetic, otherwise the lady will go numb all up and down, and it may even cause breathing troubles. You're just trying to get close to the rich blood supply just on top of it, and affect the lateral spinal nerves, the spinal nerves. That's the word I was after earlier. Spinal nerves that go out between the intervertebral. I think I was calling them intervertebral nerves. They're just called spinal nerves. Spinal nerves that go out to the sides. That's what you're trying to get with an epidural. Okay, nothing to say about sacrum except that it's forming part of the pelvic girdle, but it's included here because it is vertebrae. And coccyx sometimes gets injured, and ouch, that really hurts. If it does, and sometimes it breaks during childbirth. So yeah. Okay, let's put our whole skeletal system back together briefly, and there we see the sacrum attached to the pelvic girdle there, all the hip bones, the ilium, the ischium, the pubis, and so forth. So that's how that fits in together, and there's the space through which the baby needs to pass, except that this is a male skeleton, so no babies going through there. Okay, that's it, I think. Oh no, it's not it, because I didn't talk about the ribs. Let me just briefly talk about ribs. So go back to just axial skeleton, hide the others, oops, show, hide the others. Okay. And all those ligaments that I was carefully hiding at first are gone, are back. Sternum. This is the manubrium of the sternum. This is the body or gladiolus of the sternum, and this is the xiphoid process. Now, a gladiolus is a Roman sword, and this is just the handle, the manubrium, the handle of the sword, the gladiolus or the body of the sword, and the xiphoid sword tip-like process. So don't punch somebody there, because the xiphoid process can get broken off and do some damage, maybe to a lung. With the ribs, there's 1, 2, 3, 4, 5, 6, 7 that are considered true ribs because their cartilage attaches directly to the sternum. So 7 true ribs, then 8, 9, and 10 are called false ribs because their cartilage all joins up with the 7th rib there. And then ribs 11 and 12 are false, but they're also floating ribs. And occasionally, you know, a celebrity will remove one or both of these ribs so that they can like fit into a tighter corset. It is a thing, but it's not a common thing. The ribs themselves, there's a head and neck, and I mean there are some landmarks on the rib, but I think we'll skip, other than, I don't know if we can see well how they attach. Fade everything else here. The head of the rib attaches to the articular facet on the body of the vertebrae, and the neck of the rib, head, neck, and then there's just the shaft. And yeah, that's it. I think we're done. Good enough for axial skeleton. Appendicular skeleton, we've got plenty to do for that. For the appendicular skeleton, remember we're going to be talking about the pectoral girdle, pelvic girdle, and the limbs, the appendages that attach. So maybe one more little recording, or maybe I'll do the upper extremities for one and the lower extremities for another. Either way, we're getting through it, and we'll be done shortly.